Welcome to Vitalaire, and thank you for choosing us for treating your sleep apnea. Obstructive sleep apnea is a common, serious condition that can successfully be treated with CPAP therapy. In today's short video, we will provide you with information on obstructive sleep apnea, or OSA, continuous positive airway pressure, or CPAP therapy, as well as what you can expect from our Vitalaire staff here today. We are here to provide your treatment as ordered by your doctor and will assess your medical and lifestyle needs to custom design a program that will ensure your best chance of treatment success. Vitalaire has over 40 years of respiratory care experience and more than 80 clinics from coast to coast, so you're in good hands. One quick note about PAP therapy. There are 3 common types of PAP therapy: CPAP, AutoPAP, and bilevel or BPAP. For simplicity, throughout this video, we will use the term CPAP to describe any of these 3. What is obstructive sleep apnea, OSA? While you're awake, the muscles in and around your throat and the back of your tongue are relatively engaged and are kept active by signals from the brain. When you breathe in, the air typically flows easily through the throat to your lungs. During sleep, the muscle tone in your throat relaxes. The throat is composed of walls of soft tissue. These walls collapse during sleep, and as the muscle is relaxed and not holding them in place, breathing can be obstructed or blocked. Now more air pressure is required for the air to pass through your blocked throat. With OSA, your chest continues to move in an effort to breathe. However, very little air is able to move in or out of your lungs due to this blockage. As a result, your oxygen levels begin to drop. When your brain realizes that you are short of oxygen, it will often wake you up enough to snort, take a few deep breaths, and then go back to sleep. You're not in a conscious state, but are technically awake. Once you're back asleep, this cycle starts over again. Most people do not remember these mini awakenings. However, they have a major impact on the quality of your sleep and how you feel day to day. Why am I so tired? To review, even though you think that you're sleeping, you're constantly waking up in order to breathe. This constant interruption of your sleep leaves you fatigued and possibly irritable the next day. Low oxygen levels in your system can also be associated with a variety of other conditions that in turn aggravate your pattern of unrefreshing sleep. This unhealthy pattern continues until you treat your sleep apnea. Why do I have OSA? Certain factors may have put you at a higher risk of experiencing sleep apnea. These factors may include excess weight, which may lead to fat deposits in the neck, relatively large neck circumference, naturally narrowed airway, high blood pressure, gender, as males are twice as likely to have OSA as females, age, with rate of OSA increasing quite a bit over 65 years, family history, use of alcohol, and smoking. Symptoms of OSA. There are many signs and symptoms of OSA which you may or may not be aware of. They include morning headaches, falling asleep at inappropriate times during the day, poor concentration, irritability, loud disruptive snoring, and again, waking up during sleep either gasping, choking, or snorting. Most or all of these symptoms will improve after successful treatment of your OSA. How common is OSA? OSA affects about 1 in 5 Canadian adults, which is about as common as diabetes, and OSA is quite significantly underdiagnosed. Of this 20%, about 6.5% have moderate to severe sleep apnea. The remaining people have mild to moderate OSA. How do I know that I have OSA? In Canada, sleep tests to diagnose OSA can be conducted in sleep labs, hospitals, or homes. The gold standard is certainly a supervised overnight sleep test or polysomnogram. All sleep testing at Vitalaire is done under the direction of local physicians who order the tests and interpret the results. In some provinces, like Ontario for example, all sleep tests are conducted at sleep labs and hospitals. Why treat my OSA? Treating OSA is not about treating snoring. OSA is a chronic health disorder with potentially very serious implications. People with untreated OSA are up to 6 times more likely to be involved in a car accident. OSA is associated with type 2 diabetes, depression, hypertension, heart disease, heart attacks, stroke, and obesity. OSA has also been found to play a role in memory and reasoning problems, as well as performance difficulties at work or any other activity that requires you to be alert. Quick review. Let's have a quick review before moving on to treatment options. The following should now make sense to you. You stop breathing during your sleep. You know why this occurs as your throat muscles relax and airflow is obstructed. You know that your brain wakes you up into an unconscious state to breathe. You know why you're constantly feeling tired and fatigued. You know that OSA can have negative impacts on your long-term health. And finally, you've learned that OSA can be effectively treated. CPAP treatment. CPAP, or continuous positive airway pressure, is the gold standard in treating OSA. CPAP works by providing air pressure to the throat to prevent the throat muscles from collapsing and blocking your airway while you're sleeping. CPAP is safe, drug-free, and 100% effective at treating your OSA when used as directed. The key is getting used to CPAP therapy and staying on CPAP therapy. Treatment initiation. What to expect today. We will now find out from you what your needs are and how we can design a program that best meets your expectations. We will assess your lifestyle and medical history to help us determine the best treatment approach and products for you. We will ask a few questions to make sure we have all the relevant information to offer the best solutions. Having your bed partner at this assessment is helpful to painting an accurate and complete picture. We will then probe specifically on matters affecting mask choice, including any features that may affect mask fit and comfort. With this deeper understanding of your life and your requirements, we're now ready to move on to the treatment itself. Your doctor or sleep technician may have already chosen a CPAP unit for you. If not, we will help assess your CPAP equipment choices based on your personal evaluation. Each CPAP unit has different comfort features, flow patterns, and adjustments. Most also have a recording capability that can determine how effective your treatment is. Together, we can determine which unit best meets your needs. We will then discuss the various mask options available to you. We will consider the pressure that your doctor has prescribed and the characteristics of your face to determine the most comfortable mask fit. Your main choices are a full face mask, a nasal mask, or a direct nasal mask. Along with choosing the type of mask, we will provide you with a custom mask fit. We will focus on minimizing mask leaks and maximizing comfort and effectiveness. Once these important choices are made, we will set the features and delivered pressure as prescribed by your doctor, discuss potential accessories, and options such as heated wire tubes for maximum comfort. This will be followed by a discussion of your treatment or trial protocol. What to expect when you leave the clinic today. At your appointment, we will provide you with literature that explains how to take care of your equipment, where is best to place it in your home, how to clean it, when to replace certain parts, etc. We will proactively answer any questions that you have so that you feel confident and comfortable with your therapy. Feel free to contact us at any time. But rest assured that we will be contacting you in the first few days after you start therapy to ensure that you're adjusting well and have no questions or concerns. We will book a follow-up appointment with you so that you can come in, talk to our healthcare professional, have your sleep data downloaded and reviewed. We'll also discuss our long-term care programs and protocols with you, including recommended replacement times for parts, so that you understand the importance of ongoing therapy compliance to your health. We will be here for you to provide regular follow-up and care every step of the way. Your new road to a healthy life. Once successfully treated, people with sleep apnea can return to enjoying life to its fullest. Benefits from treating OSA fall into two main categories: lifestyle benefits and medical benefits. Potential lifestyle improvements include alertness while driving, job performance, mood and energy, sexual drive and performance, quality of life, and reduced bed partner disturbance. You may also experience improvements in your cardiovascular health, glucose control and insulin sensitivity, and depression. But most important, you've taken a big step when treating your OSA to improve your life and your health, and you should congratulate yourself. We hope that you've enjoyed this opportunity to learn about obstructive sleep apnea, why it's so critical to take it seriously, and how it can be treated successfully and comfortably. Our staff will be with you shortly to discuss this video and answer any questions that you may have. Then, we will move on to setting up your CPAP therapy. But first, it is important for you to recognize that CPAP therapy takes some adjustment and getting used to, and that some people get used to it faster than others. From today on, we need you to make a commitment to treating your OSA, and the best way to do this is to use your CPAP unit and mask whenever you're sleeping, starting tonight. In return for that commitment, we at Vitalaire will address any of your concerns, ensure that you're getting the most from your CPAP therapy, and invite you to our clinic anytime to advise and reevaluate as required. Vitalaire is here to meet your needs across Canada, so please feel free to contact your local healthcare professional if you have any questions or concerns.